Welcome to the Smith & Nephew Wound Club online module on the importance of an infection management pathway, which forms part of a series of modules you can access to develop your knowledge and understanding around infection management. My name is Sherry Pearce, Complex Wound Specialist at Smith & Nephew. Today we will be discussing the importance of an infection management pathway. By the end of the module, you will be able to Number 1, understand how the infection management pathway can potentially improve patient outcomes. And 2, reflect on the different signs and symptoms of infection. Pathways in general have many benefits for clinical practice. They can help to reduce variations in clinical practices, communication through continuum of care, help improve clinical outcomes, and improve formulary compliance. When pathways are supported by clinical evidence, they promote organised, efficient and effective patient care. Based on global practicing, clinician survey feedback and in collaboration with international wound experts, the infection management pathway was created and published to support and guide clinical practice. The pathway is designed to give the clinician confidence when diagnosing the type of wound infection that is being presented. In the following slides, we will break down each section in more detail. Treat the whole patient, not just the hole in the patient. In order to manage your wound appropriately, a comprehensive assessment of the patient, their environment, wound etiology and wound are necessary, as all of these components affect healing trajectory. Specifically, a comprehensive assessment of the patient well-being and the wound is recommended with the ABCDE method. A. Assess patient, well-being and wound. Review history, associated comorbidities, limitations to wound healing and formulation of diagnosis. B. Bring in multidisciplinary team. This includes caregivers and specialists to ensure a holistic approach to care and treatment. C. Control. Management of factors contributing to wound development and barriers to healing potential. D. Decide. Formulation of an appropriate plan to action to treat. E. Evaluate. Continuous assessment of the patient and response to treatment intervention. Specific to wound infection, comprehensive assessment supports early detection and aggressive intervention of strategies. Assessment begins with recognition. Recognition of signs and symptoms of wound infection is crucial for healthcare professionals. The initial diagnosis of a wound infection is a result of the clinical assessment of the patient, the wound, and the peri-wound tissue. The wound's etiology contributes to infection risk, development and the immune system of a patient to defend against infection. Acute or overt infection is usually obvious to experienced clinicians as these wounds present with the classic overt signs and symptoms of wound infection. However, the covert or subtle signs and symptoms of infection are more challenging to identify. As recognition and diagnosis is of the utmost importance, let's examine the infection management pathway further. Once the signs and symptoms have subsided and the wound is positively progressing, transition to non-antimicrobial dressings and advanced therapies are indicated as next steps in infection management pathway. This transition supports antimicrobial stewardship, AMS, as a means to maintain maximum efficacy for the future. Wound infection is complex and challenging. The pathway can help act as a quick reference tool to guide diagnosis and appropriate treatment for infected wounds or those with suspected biofilm. Build confidence in practice, no more guessing. Guide early effective intervention. Encourage appropriate antimicrobial use. Support consistent approach across teams. Using the pathway may help to improve patient quality of life, improve clinical and economic outcomes, and improve resource management. Thank you for your time and attention today. To check your knowledge and understanding, try and answer the quiz questions. Well done. You've now completed this bite-sized module. Take the time to reflect on how you will take some of what you've learned and apply it into your daily practice. Please click on the link in the description below to go to the full 15-minute version of this presentation. Once it is completed, you will have the opportunity to download CPD revalidation forms. Thank you for your time today. Please remember to look at the other sections to access additional modules to help you on your learning journey.